Today we are going to be doing a knee conditioning rehabilitation program. Again, please make sure to consult your physician and physical therapist before starting this program. If you feel any pain or discomfort while doing your program, please stop immediately and consult with your physician. Also, make sure it's very important at the beginning, especially if you're coming off of surgery, is to make sure that you are icing and elevating your knee, especially after doing a conditioning program like this for 10 minutes. All the workouts again today are going to be used with household items if needed or just using your body weight. Now let's get started. Best of luck in your recovery.
It's good to keep your calves stretched out when recovering from a knee injury. To get a deep stretch, you should lean your body closer to the wall. If you need to take off from your stretch, just lean away and not put as much pressure on the wall. Make sure to not arch your back. The soleus is another great muscle in the calves to stretch out and keep mobile during a knee conditioning program. The only difference in this stretch from the calf stretch is that you bend both knees slightly. Push your weight into the wall for a deeper stretch. Make sure to not arch your back. Make sure to place the heel of your foot on the can and not the back of your ankle. Try to relax your leg and let your knee extend as much as possible. Stretch is good for your quads and helps reduce knee pain. You should not have any pain or move the knee while completing the exercise. Contract the quad as much as tolerable. Movement of the patella is essential for restoring range of motion in the knee. Only small movements up, down, and side to side are necessary for this movement. Do not put excessive force on the patella. Let gravity help you slide your knee down the wall to help with natural knee flexion. This exercise may also be done by sliding your heel along a bench or couch. You may also use your opposite leg to help increase the flexion in your knee. Only go as much as tolerable. Do not push through sharp, stabbing pain. This exercise can be done on the bed or standing up. Make sure to stretch both legs and do not arch or twist your back. You should feel this in your hamstrings and behind your knee. The farther you pull your leg towards your upper body, the deeper the stretch will get. Only stretch as deep as tolerable. Do not put your hands at your knee joint and pull. You should feel this exercise in your calf. You may hold on to a stable surface if needed. Make sure to keep your weight centered on the balls of your feet. You may do both legs at the same time or one at a time as a progression. This exercise helps strengthen your outer thigh and glutes. To progress this exercise, add weight to your ankle by using a beanbag and lanyard or anything you can tie to your ankle to add resistance. To modify, do not lift your leg as high off the bed. Make sure to not rotate your leg in an effort to raise your leg higher. This exercise helps strengthen your inner thigh. You may progress this exercise by adding weight around your ankle. You can modify this by not lifting your leg as high. Placing your hand on the bed in front of your stomach will help support you. This exercise helps strengthen your hamstrings and glutes. Make sure to start with no weight and then progress to adding weight on the back of your ankle. To modify this exercise, do not lift your leg as high. Make sure to keep your pelvic bones on the bed. This exercise helps strengthen your quadriceps. You may progress this exercise by adding weight to your ankle or modify by sitting in a chair performing the action instead. Make sure to not tense up your neck and shoulders. You should feel this exercise in your hamstrings. You may progress this exercise by adding weight to the back of your leg. You can perform this on a bed or couch or standing up. You may use a solid surface to help you with your balance if standing up. Make sure to flex your foot and keep your knees close together. You should feel this in your quads, glutes, and hamstrings. You may progress this exercise by going into a deeper squat and then eventually add weight. You can modify this exercise by not going as low in your squat. Make sure your knees do not go over your toes and do not bend forward at your waist. to step up with the affected leg and down with the uninfected leg. You may progress this by getting a thicker book to step up on or a lower surface if it's too challenging. Make sure to completely stand up straight with both feet on the book before stepping back down. And make sure to step up with the affected leg and down with the uninfected leg. You may progress this by getting a thicker book or lower surface to step up on. Make sure to completely stand up straight with both feet on the book. Try to bounce first with your eyes open and with one leg. You may progress by closing your eyes. You may modify this by not having a towel under your leg. It should be completed after your knee is stable enough to handle impact. Make sure to land both feet shoulder width apart at the same time. You may progress or modify this exercise by adjusting the height you jump off of. Complete this when your knee is able to handle impact. Do not bend at the waist. You may progress this exercise by doing a deeper squat and only jumping off of one leg. You may also modify and do a mini squat with a heel raise. You may progress this move by getting into a deeper lunge or modifying it by only doing a partial lunge. Make sure your knees do not go over your toes. This helps strengthen your quads, hamstrings, and glutes while focusing on one leg. You may progress this by adding weight and doing a deeper lunge. You may modify by not going as low in your lunge or use weight.
Great job today, guys. Remember to make sure that you ice and elevate your knee for 10 minutes after doing this program. Please come back tomorrow for our spine and neck conditioning program. Stay healthy and stay safe. Thanks.